Type 2. Diabetes mellitus. It accounts for more than 90% of patients diagnosed with diabetes. Unlike type 1 diabetes, in which the individual has an absolute insulin deficiency, individuals with type 2 diabetes have a relative insulin deficiency in part because of a resistance to insulin action. Most patients with type 2 diabetes are obese and are diagnosed after the age of 30 years. Insulin resistance is related to polygenic factors: obesity, sedentary lifestyle, and aging. Abdominal obesity aggravates insulin resistance that results in hyperglycemia, leading to further hyperinsulinemia. Type 2 diabetes occurs when the hyperinsulinemia is insufficient to correct the hyperglycemia. Diffuse damage to more than 70% of the pancreas can cause diabetes. Examples of such insults include pancreatitis, trauma, pancreatic carcinoma, hemochromatosis, and partial pancreatectomy. Excess production of the 4 insulin counter-regulatory hormones can also cause diabetes. For example, diabetes may be the initial presentation of the following endocrine disorders: pheochromocytoma, acromegaly, glucagonoma, and Cushing syndrome. Patients with thyrotoxicosis or somatostatinomas may also have diabetes. The hyperglycemia in patients with these endocrinopathies typically is cured by effective treatment of the underlying disorder. Approximately 5% of individuals with type 2 diabetes have a monogenic disorder, maturity-onset diabetes of the young, resulting in a defect in glucose-induced insulin release. These individuals are usually not obese and are diagnosed with diabetes in late childhood or as young adults. 6 types of autosomal dominant MODY have been described. MODY 2 is caused by impaired conversion of glucose to glucose 6-phosphate in the beta cell because of a mutation in the gene encoding the glucokinase enzyme. Type of MODY and mutation in gene that encodes factor. MODY 1, hepatocyte, nuclear factor 4, alpha. 2. Gene coding for glucokinase. 3. HNF1 alpha. 4. Insulin promoter factor 1. 5. HNF1 beta. 6. Isolate transcription factor NeuroD1. The combination of abdominal obesity, hyperglycemia, hyperinsulinemia, dyslipidemia, and hypertension has been referred to as the metabolic syndrome.